So we're going to go ahead and get started. Hi again to everyone who is on our presentation. Welcome to How Prediabetes Affects Your Menopause Journey, Myths and Facts. We have a special conversation today between our Chief Medical Officer, Dr. Kathleen Jordan, and our special guest from Diabetes Digital, Jessica Jones. And before we get started, I'd like to just touch on a few housekeeping rules. Participants, you're going to be muted. However, please feel free to use our Q&A box to drop all of your questions. We'll be going through them during our Q&A at the end of the webinar. But please keep in mind that all the information that is shared today is for educational purposes and not to be taken as specific medical advice. Those conversations are perfect for a MIDI visit that you can learn more about, which leads me to our next slide, just reiterating the reminder. And before I turn it over to our fabulous speakers, I'm going to go ahead and introduce you guys to MIDI. If you're new here or if you attended our webinars in the past, MIDI is a virtual care clinic. We specialize in perimenopause and menopause and total women's health. We're available in all 50 states and we're covered by PPO insurances. So if you're joining us today from social media, from one of our employer partners, or you just stumbled across this presentation, or from Diabetes Digital Community, welcome, and you can learn more about us at joinmidi.com. Now I'm going to turn it over to our speaker today, Dr. Kathleen, to introduce herself.
Hi, good morning. I'm Kathleen Jordan. I'm a physician at MIDI Health and Chief Medical Officer, and I help lead the team that's helping women address all sorts of health issues in midlife, one of which can be prediabetes or diabetes. I myself am an internist, and I will share that I also have a family history of diabetes and have had prediabetes myself. So I'll share some of that story as well. And I'm delighted to be doing this today with Jessica Jones, who's going to introduce herself now.
Hi, everyone. My name is Jessica, and I'm a registered dietitian and diabetes educator. And I'm so excited to be here and talk about this topic because I also have had prediabetes and am going through early menopause myself by way of primary ovarian failure. So I can relate to both sides of the story, what we're going to be talking about today. I'm a dietitian. I've worked in the field for over a decade. I'm also the CEO and co-founder of Diabetes Digital, which is a virtual nutrition counseling platform for people with diabetes and prediabetes. I'm also the co-author of a couple of books. One of them is a diabetes guide to enjoying the foods of the world. And yeah, I'm just really passionate about making diabetes and prediabetes care more culturally inclusive, accessible, and all those things. And
go ahead, share about diabetes.
Okay. The screen went away from me, but so Diabetes Digital is a virtual nutrition counseling platform, as I mentioned, for people who have diabetes and prediabetes. And the nice thing about us is that, like MIDI, we also accept insurance, and we are networked with most of the major insurance companies. We're in 28 states, so not 50 yet, but we're working to get to 50. And we're in, some of the bigger states like New York, California, Texas, Florida. And we have a team of incredible, diverse dietitians. I see a couple of them on this webinar today. And yeah, everybody is just passionate about, like I said, helping people with diabetes and prediabetes in a way that is culturally inclusive, weight inclusive, and very personalized.
Thank you so much. Technology just jumped ahead to the survey the poll that we have for today. So participants, you're going to see a poll pop up on your screen. Take a second and participate. The survey is completely anonymous, so feel free to participate. Okay. So I'm going to go ahead and end the poll. Thank you for everyone who participated. And here are the results. 57% know that they do have prediabetes.
Right. So a little bit higher than the general population, but that would be expected because that's why you probably came to the webinar.
Okay.
But it is a lot of us. I think we should realize that it is a lot of us.
Awesome.
Which gets us to our first myth. So thank you everyone for coming. Jessica and I get a lot of questions. So we put together sort of our commonly held questions and commonly held beliefs. So that we'll answer those up front for you. And then please, as we go along, you can put questions in the chat and we're going to save time at the end to answer questions as well. But we'll start with some of the common sort of myths and questions. So myth number one is that you really only need blood sugar levels checked if you have symptoms. And really, this speaks, that is not true, right? So really, we should all be getting screened starting at age 35 and probably every 2 to 3 years afterwards. If we have high risk for having high blood sugar problems, such as having gestational diabetes, having a baby that was more than 9 pounds, having a family history, being overweight, right? So if we have risk, or if we have a very inactive lifestyle, those are all risk factors for having both prediabetes and diabetes and may make you want to be screened earlier. We also know, and we'll talk about in a few minutes, certain ethnic groups get them younger than others. So we should be getting screened because most people are asymptomatic when they're in the prediabetes range. About 40% of adults will have prediabetes and only about 1 in 5 know it. So most people don't even know it. And I will share at MIDI, I have many patients who upload their labs to me that were drawn elsewhere or previously, and they tell me they were normal and told they were normal, but in fact, they're in prediabetes. So we have people who've been tested and not even told about the results. So I'm glad you're at the webinar. We'll teach you some numbers to look for. And how to be aware if you're in the prediabetes range. Jessica, did you have anything to add?
I feel like you covered all of it. I was just going to say that according to the CDC, nearly 90% of people who have prediabetes don't know they have it, which is shocking numbers. And, I think, as you mentioned, like, not everybody with prediabetes is going to develop diabetes. We'll talk about that. But I think it's important to know your numbers and know your baseline because that might inform some of the choices that you make, right? Like if you might decide like, oh, I see I'm in this range, like, okay, this motivates me to be more physically active or whatever the case may be. So I think it's important to know and to get that screening regularly, as you mentioned.
Right. And even while diabetes has been shown obviously to be linked to renal disease, cardiovascular disease, lead to amputations, prediabetes in and of itself does bring some risks, granted less than when you're in the diabetes range, but it has some inherent risk itself. And I think it's increasingly appreciated that may actually impact cellular repair and some other things that happen as we age. All right, we'll go to the next commonly held question and myth for you, Jessica.
Yes, this is all about carbohydrates. And let me tell you, the amount of people who, when they get diagnosed with diabetes or prediabetes, who feel that they have to cut out all carbs, it's staggering. And I always tell the story. I am in some diabetes Facebook groups, some diabetes support Facebook groups that are kind of peer groups. And every day there's people who are newly diagnosed or they have prediabetes and they're saying like, oh, how do I cut out all carbs? Like, please help me figure this out. And everyone's giving each other advice. And I'm like, no. And I always will say like the first thing that I learned as a dietitian or in dietitian school was that carbs are our friend. They're important. And that's whether or not you have diabetes. And the reason is because carbs are the preferred source of fuel for our brain and our central nervous system. Carbs break down into glucose. So many people have heard the term blood sugar, that's also known as glucose. And the brain requires a constant supply of this glucose in order to function optimally, since it can't store that glucose. So it relies on that constant stream of blood glucose so that it can function. And, we need adequate carbs for cognitive function. Sometimes when people are doing really low carbohydrate diets, like they might have difficulties with concentration, with mental performance. And of course, because many people are like, but wait, what about keto? Like that's low carb, and people are fine on that. And yes, like it is true that during periods of fasting or low carb intake, the body can produce glucose through a process known as gluconeogenesis. However, the process is not as efficient, and it can lead to breakdown of muscle protein, which is something we definitely do not want. And we don't want that if we are in the prediabetes or diabetes range. So we definitely want to have sufficient carbs to support overall brain health. Now, what I will say is there are differences in types of carbs, and not all carbs offer the same nutritional benefits. Having said that, I am an all foods fit dietitian, so I don't like demonizing foods. But if you are someone who's like, okay, I want to focus on my prediabetes, I want to know like which types of carbs are going to be more helpful, then I would say you might want to focus a little bit more on complex carbs versus refined carbs. So complex carbs are things like whole grains, beans, veggies, fruits, and refined carbs are like kind of more the things that people think about when they think of carbs, like candy, cookies, pasta. And so it's just really important to get those complex carbs in because they're going to help us have more fiber in our diet. And fiber helps to slow the release of the sugar, the blood glucose, into our bloodstream. So that's what I'll say about carbs. I have more to add, but I don't know, Kathleen, if you want to add anything as well, or.
Yeah, no, it's the similar advice we give at MIDI. Just more, it's about a balanced diet because sometimes when you're over heavy on carbs, it means you're not eating other foods that that you need for nutrition, right? So we see adults with low vitamin D levels and lower other essential vitamins and nutrients. So a balanced diet is good that bring in all the essential vitamins and nutrients. And I think probably in the US, we are a little heavy on carbs. So I think many Americans could probably do a little bit more of other nutritious food sources.
Yeah. And the way
go ahead.
Okay.
No, go ahead.
I was going to say the way I like to explain it to patients is my favorite tool is the MyPlate method. So essentially that's taking your plate and making half of it non-starchy vegetables whenever possible, or even 1/3 non-starchy vegetables. 1/2 can be your more starchy carbs, things like pasta, bread, 1/4. And then 1/4 is your lean protein. So if you have that balance, you're naturally going to get that fiber that's going to help slow the release of the sugar into the bloodstream and help your blood sugar to stay more balanced overall.
Fabulous. All right, let's go to myth number 3. So prediabetes is an equal opportunity for no, right? So it can look very different. Our metabolisms are very different. Our cultural food intake preferences can be very different. Examples are the Hispanic population will actually get prediabetes and diabetes earlier. They have a much higher incidence in youth. Asian Americans are more prone to getting prediabetes at lower weights. Weight is only one contributor to and risk factor for prediabetes, but for whatever reason, at lower BMIs or lower weights, Asian women will tip into prediabetes more than other ethnicities. We also just see higher incidences of glucose in certain ethnic groups, like Black women, it's up to 46%, while others it might be 39, 40%. So we see different stages, we see different risk factors with different triggers. So I'm going to say we're all different from each other, but there are definitely differences and trends. Jessica?
Yeah. And I think, a lot of people might be wondering, well, why are we having these differences, right? Like, where do they come from? And I think, researchers used to think that these differences in rates was only because of genetics. And now they're realizing that there's other things that play a huge role. And so I think it's important to talk about the social determinants of health, which for people who are hearing that for the first time, those are non-medical factors that influence health outcomes. So that can be things like where you're born, how you grew up, where you live, where you work. And they encompass things like your economic stability, chronic stress, education, access, quality, healthcare access, right? Because we know that while we're trying to make healthcare, MIDI and Diabetes Digital more accessible and having shorter wait times, like a lot of folks, the clinic maybe in their neighborhood has very long wait times. I know the local clinics here, even in Sacramento, it's like 6 months waits for just a regular appointment. And so those disparities can really play a role in preventative care and education. The neighborhood, again, like access. I used to work at a clinic in East Oakland, and I would teach a cooking class for adults and kids. And I remember like the grocery store and the clinic, the produce was so bad. I would on my lunch break drive all the way to a Trader Joe's, which was like, I don't know, 15, 20 minutes away, so I could get produce. And I even remember one time we were going to do something with yogurt. I bought a carton of yogurt. I opened it up and it was like all rotted on the inside. And I just thought, oh my gosh, like if I only had access to these foods, like that would change everything about how I'm eating. So I think we have to look at, racism, all these things can play a part in how our body, responds to these different stressors and that put us at risk.
Yeah. All right. But there's a lot more we could say on that. But in the interest of covering a breadth of topics, we'll go to myth number 4. Do you want to comment on, I love this question, we get it asked all the time with the rise in popularity of fasting diets. Does it help with this?
Yeah. Okay, so this is one that we also get all the time. And we are not, okay, we take an individualized approach, I will say. And so if something is really working for you, great. But we often have people define like, what does working mean also? Because for me, working encompasses your physical health, your mental health, how well you're able to enjoy your life, the foods you're eating. And so for us, and what we see in the research, skipping meals can lead to blood sugar spikes and crashes. That can lead to poor glycemic control at the end of the day. And regular meals, like having, steady, consistent breakfast, lunch, dinner, snacks, if you need them, can help maintain blood sugar levels throughout the day. We also find that folks who skip meals tend to have increased hunger and overeat later. That's like one of the biggest triggers for people who say that they binge at night. It's like they're not really eating anything during the day. And of course, having no food and then having a lot of food, like that's going to make your blood sugar really erratic. There's even some studies to support this. There was one that looked at women who consume 2 meals per day and skip breakfast. They had increased odds of having elevated fasting glucose. So there is research to support that it's helpful for people who are looking to optimize their blood sugar control to have those consistent meals and snacks throughout the day.
Yeah,
Anything you want to add?
Yeah, I think the data on this is emerging. Right. So I think older studies showed it probably didn't help. I do think your point earlier about it being individual is important. So for some people, this is a very easy, accessible way to actually look at what they're eating and pay attention to what they're eating. They don't have to buy special foods. They're still eating with their families. They're still enjoying the meals. They're not doing special shopping trips. And it also cures them of snacking. And usually snacking is reaching for highly processed foods, probably your least nutritious, right, of your intake for the day. So if you are prone to stress eating or stress snacking, or this can actually be an easy way to control. And then there's been more recent literature, I think, over the last really 5 years that show that some period of being having not constant intake can actually improve your glucose utilization, which is another way to say insulin sensitivity. So I think there's a lot emerging on this, but I think for some people this can be an effective strategy, but not for everyone. Is that fair?
Yeah, I think also because like you had mentioned the stress snacking, and My philosophy is that it's better to get to the root cause of what's going on and how can we help to manage the stress and manage our reaction to the stress versus just saying, okay, because I feel like from my perspective, like just cutting the foods off at a certain time or starting at a certain time, that doesn't really get to the root cause. But again, that's what everybody's different. And I think it's really about an individual approach and what makes people happy and what they feel they can do forever, because that's another thing. It's something some people do intermittent fasting and it's like great. And they're like, oh my God, I don't even eat breakfast anyway. Like I feel energized. And there's other people where it can be more stressful on their body. It's not as natural, it's harder. So I think, as you mentioned, it's just an individualized approach.
It is. That's why Diabetes Digital and we exist, right? To help people through. Yeah. All right. Okay, this is a big topic. It's like the whole thing. Midlife changes, such as menopause, don't affect prediabetes. That is not true. There is a lot of research that shows that the changes of menopause and the changing estrogen levels and estradiol levels do affect your metabolism in multiple ways. Look at the WHI study. This was done in the late 90s, right? So even looking at that, they looked, not only did the depletion of estrogen was associated with more diabetes, taking hormone replacement therapy actually decreased your risk of diabetes by 21% in that study. So there's lots of studies that show that menopause in and of itself changes our metabolism. We start to have more skin instead of just more associated with poor health outcomes, right? So that change is not good for health. We also know cholesterol levels go up in our liver. We have them all. Can you hear me?
Hello, Dr. Kathleen? Jessica, are you fine?
Yeah, I'm fine.
Okay.
Yeah,
Okay.
I do know she's cutting in and out a little bit. I don't know.
Oh,
Can you go on?
Maybe if you could turn your camera off, that might help.
Yep.
Better? Okay.
All right. Can you hear me now?
Yeah, we can hear you now.
Yes.
Yeah, sorry. So we do know that we have estrogen receptors in our liver and other places that metabolize our foods. So we know that the depletion of estrogen is associated. I think we're still exploring, and there's emerging research on the exact mechanisms, but we definitely know that estrogen levels can impact our metabolism. We see cholesterol go up, we see blood sugars go up, we see more people getting into prediabetes. It is also the time of life when we weigh more, which is one of the many risk factors, not the be all end all. And we know that taking hormone replacement therapy can negatively impact metabolism. So there are links. And so we definitely at MIDI will screen people entering into perimenopause and menopause for prediabetes and diabetes. And we diagnose people really daily. I don't know what your experience has been, Jessica. Did you want to add anything?
Yeah, I can add my personal experience. My blood sugar was always fine. And when I went into the primary ovarian failure, which meant I had no estrogen, all of a sudden I was in prediabetes. So I have that firsthand experience of it didn't, I mean, there were things that changed because it was also during the pandemic and our lifestyle did change during the pandemic, but it wasn't like anything drastic. And so when I did get on the HRT and then also did the things that we recommend at Diabetes Digital, right? Like more physical activity, more fiber, the blood sugar went back into normal range. So it's just a case to show that our numbers do change, but they can go back.
Yeah. And both my cholesterol and hemoglobin A1C went up with perimenopause and menopause. And again, I did go on hormone replacement therapy, but I also did other interventions. So I think we have this conversation a lot with women. Our bodies are changing in midlife, right? It's partly age, it's partly menopause. There's certainly a lot of significant changes with the hormone changes. And we need to adjust with it to really just stay in our optimal health, right? We probably need a little bit fewer carbs than we did when we were younger, but or fewer calories, and we need to actually just lean into our health. It's a good time to lean into health overall. All right, let's go to myth number 6.
Okay, once you have prediabetes, you will definitely develop diabetes. No, this is false. And as we have, talked about, there is a lot of research to show that lifestyle interventions can be even more effective sometimes than medications. Sometimes they'll be really effective in conjunction with medications like metformin. And typically, in the studies that I've seen, these lifestyle interventions involve physical activity. So things like cardio, maybe walking, but also strength training is really good because, as we mentioned before, it can help you preserve your muscle mass, which will help increase insulin sensitivity. So it's really important. I always tell people to do a combination of both cardio and strength training for optimal blood glucose control. And also, things like we had mentioned, the MyPlate method, adding more fiber, adding more protein to your diet, can all be very, very, very helpful in regulating your blood glucose levels and keeping you out of the diabetes range. And not all people, like we mentioned, not all people, even if you don't change anything, like not everybody is going to develop diabetes. Like the numbers can fluctuate, like hormones can affect them, as we talked about. But I know many people with prediabetes, they want to do what they can in a healthy way to, have a positive impact on their health. And studies show it can be really effective.
Right. No, I want to double down on 2 messages there because I think there's there's a lot of great pros on what you're saying, but double downing on your fiber comment. I think the average American in diet has 12 grams of fiber in it per day. And really, for optimal health, you want 25 to 30. And a high fiber diet is associated with better glucose control, so can help really address prediabetes and diabetes. And then, not by coincidence, many high fiber foods are also highly nutritious, so it's good for you. And exercise. So exercise actually helps your glucose metabolism and will actually lower your hemoglobin A1C. So I think we think about nutrition, and some people think about weight all the time, but exercise is hugely helpful, and inactivity is actually a risk factor for prediabetes. Yeah. I feel like we skipped right into the pre-diabetes, diabetes thing. I wanted to make sure everybody understands what it means to have pre-diabetes or diabetes, right? So the numbers used in the literature are really, if your fasting blood glucose is above 126, above 125, you're generally in the diabetes range. If it's between 100 and 125, that's the pre-diabetes range. And then your optimal glucoses are going to be under 100. There is another lab test that people often use called the hemoglobin A1C, which really reflects your average glucose over the last month. And the range for full diabetes is when your hemoglobin A1C is above 6.5, and then 5.7 to 6.4 is in the pre-diabetes range. So if you've had your hemoglobin A1C check, look at it, because sometimes clinicians will tell you it's normal just because it's not in the diabetes range, but you may in fact be in the pre-diabetes range, which just means there is room for optimization, that you can optimize your health by getting it into lower ranges. And usually you want more than one test to be abnormal to carry the diagnosis. So often they'll get a glucose and a hemoglobin A1C on the same draw. If they're both consistent, that's fine. If they're different, you may want another test at a different point in time. But if you look at it, I think it's 12 to 14% of Americans will get diabetes, but it's roughly around 40% of adults with prediabetes. So about a third will develop into diabetes. But if you are in you may have a higher risk than that. If you have a heavy family history, if you have a hemoglobin A1C that's 6.3, you're probably more likely to flip into diabetes than if it's 5.8, right? So everybody's risk isn't the same, but I would say everybody with prediabetes has some opportunity to optimize their health.
Yeah. And I just wanted to add, because you talked about fiber, and I had a list of a couple of high fiber foods in case anyone's like, what foods have fiber, and I want to add some. So chia seeds, 28 grams, has 10 grams of fiber. So that's something you can add to your smoothies or oatmeal. Lentils, 1 cup has 15 grams of fiber. 1 cup may be a lot because it is a lot of fiber, but even half a cup at 8 grams is amazing because remember we said the goal is about 28 grams a day. Same thing with black beans, 15 grams, and then raspberries. That's something I've been adding in a cup as a snack here and there, and those have 8 grams of fiber per cup. So a few things you can add in starting, today or tomorrow that can significantly boost your fiber intake.
It's a great time. If you have questions or comments, please put them in the chat or the Q&A, and we'd be happy to answer. If not, I'm going to ask Jessica all my questions. I'm curious, a lot of people are using chia seeds. Some people are using flax seeds as a way to increase their fiber intake. Do you prefer one over the other?
Not necessarily. I think it's just honestly a taste preference. If you are going to do flax seeds, if you grind them or you buy ground flax seeds, that's going to be better for absorption. So I will say that. But I recently, like last week, bought this bag of a mixture. It had, I forget what the brand was, but it has chia seeds, flax seeds, and hemp seeds all together. And I was like, oh, this is perfect because I get a variety of all of them. So I think it's, just whatever you have access to and whatever you prefer.
Good. All right. So we get our final messaging here. Jessica, do you want to go first?
Yeah, I can kickstart. So number one is it's not your fault. I think a lot of people who either have diabetes or prediabetes, there's so much shame around it. And we want to take that shame away because it's a complex disease. There's a lot of factors at play, many of which we talked about, that can increase risk. And so don't blame yourself. I think that's most important. Also, medical nutrition therapy, which is what dietitians provide, studies suggest that we can really help to decrease your A1C pretty significantly, and sometimes as little as like 3 months of working with a dietitian. And we've even seen like our first patient, and Jenny, the dietitian, not to call you, I saw her on the webinar. She had our first patient ever, and that patient went from I think it was an A1C of 6.3 and they went down to 5.7 and just doing very sustainable small changes, and the patient was shocked. But it's like these things really do work. And then of course, if people do want to work with us or have us do a complimentary benefits check, you can sign up at diabetesdigital.co/quiz, and we'll check your benefits and get you scheduled with a dietitian.
Fabulous. Right. And looking at the holistic care model we have at MIDI, I'll add to that and totally agree with everything you said, in that there's lots of effective interventions that can help you optimize your health in midlife. Lifestyle adjustments that are sustainable. Again, something that's so extreme that you're miserable is not going to be something that you sustain. So sustainable lifestyle adjustments are really the way to go. And they are shown in time and time again to be the most impactful on whether you develop full diabetes if you have prediabetes. Hormone replacement therapy can help. I think it's probably underutilized. Less than 10% of midlife women are on it. And I think many more could benefit. It's not for everyone, but it's for a lot more people than currently access it. There's also non-hormonal medications, which we didn't talk about. There are no FDA-approved treatments for prediabetes. There are some medications that have been shown to decrease your chance of getting full diabetes. One of them is metformin, which is really a diabetes treatment, right? It's a drug that's been around for decades and decades. And the new GLP-1s can also improve your insulin sensitivity. So it's really kind of an early intervention that can help. There's also supplements. being depleted in vitamin D, for example, has been linked to actually more prediabetes. So there's some just replacing and making sure you have enough nutrients, and there's some supplements that have actually been shown to help with insulin sensitivity as well. And then exercise, and other managing stress, because stress actually creates cortisol, and cortisol is a steroid that actually worsens your insulin sensitivity and raises your blood sugar because you go into a fight or flight response. So it's pouring sugar into your bloodstream. So there's lots of lifestyle things that can help really mitigate some of these risks. So we love to help women wade through that as well. All right. So we are getting some questions already, and there are lots of great ones for you, Jessica. What if your potassium or calcium is high? Do you have any comment on that? Or
I don't necessarily have a. Yeah, do you want to take that one?
yeah, so if your potassium is high, well, if your potassium your potassium should be regulated by your kidneys, right? So, and your potassium functions by helping with your electric cardiac system. So if you have super high potassium, it can be a risk for heart problems and arrhythmias. So that you should be seeing probably a nephrologist for. So usually it's not a problem with it being high. You can see people with low potassium, which can be diet and nutrition approached as well. And then both vitamin D and calcium are linked to bone health. And then since we're talking about midlife, in midlife, once we enter menopause and see our estrogen levels decline, you start to lose 2% of your bone density per year in the first 5 years of menopause, and then 1% per year thereafter. So paying attention to your bone health in midlife is important because we start to get fractures. You start to have relatively minor falls, more fractures. So we need to have a diet that actually can help support bone health, which means you have vitamin D actually helps you absorb calcium. So if you don't have enough vitamin D, you're not going to be getting enough calcium. So generally, vitamin D and calcium are ones we want to make sure you're getting enough of in midlife. And the average American finds this to be challenging. So we do check levels on that. So maybe you could share some foods rich in vitamin D or calcium that you think support best bone health, Jessica?
Yeah, I would say for vitamin D, my favorite source is if you drink milk, getting it from milk, or if you are plant-based, like typically they add vitamin D. Also, obviously like getting some sunshine, going outside. I mean, if you have a history of skin cancer in your family, that might be a challenge. But yeah, like dairy foods are typically a good source. And then in terms of calcium, things like spinach, also the dairy foods, but things like spinach, broccoli, I believe lime treated tortillas as well. So just like corn tortillas, it can be a good source. Yeah, a few things.
That's good. Yeah, no, in sunshine, so we started to see the American on average having lower serum vitamin D levels when we started to work indoors, right? So we left. Yeah. So this was decades ago. So sunshine is a good source. Obviously, our risk of skin cancer goes up, but you really don't need that much. Like even 15 minutes of sunshine a day on a large body surface area can give you your daily supplements. But a lot of people also take vitamin D supplements, which are available over the counter and can be beneficial as well.
And okay, I was going to just say really quick for melanated folks like me, it's really important to check because I find that most of us are deficient. I'm not, but it's because I do the 15-minute walks every day. But oftentimes we may have to take supplements, so just make sure to get your levels checked because it can be harder for the sun to penetrate since we have our melanin.
Yep. All right, we have a couple deep dive questions. So someone is asking how hormone replacement therapy would help insulin sensitivity and reducing cholesterol levels for women with menopause. So the research really shows the association. So the association is that we know when you hit menopause, independent of age, that you're going to see worsening numbers on it. So we know the outcomes are there. And then we also have the association that when you go on hormone replacement therapy, you see better numbers. So the association is pretty there in some pretty large scale studies. Now, there's also basic science research that has tried to decipher how that happens. There is some increase in activities of your native GLP-1. Remember, like Wegovy and Ozempic they're mimicking GLP-1s, which are native hormones. So there is some research suggesting the mechanism may be that we make actually more insulin, but there's also some improved cellular utilization that I think people are still figuring out the how. But we do know I think the research is there that shows the association. Okay, another question, and this is a good one that I get all the time, so I'm interested to hear what you have to say, Jessica, is let's talk about protein and what is your guidance to midlife women and how much protein they should get?
Yeah, that's the one I was looking at. That's a great question. And so I think there are a lot of people, especially in midlife, who might potentially be under eating protein. I typically recommend that you try to get, 25-ish to 30 grams of protein per meal, because as you get into midlife, you tend to lose that muscle mass, like a certain amount of pounds of muscle mass per year. And muscle mass is really important for keeping our glucose at target. So I recommend, like the 25-ish grams per meal. And in terms of like how to get that protein in, it's not that hard if you eat meat. It really isn't. So having about a 4-ounce portion of meat is going to give you about the 25 grams. So that could be anything from like chicken to lean beef to fish. And then if you're someone who is plant-based, then you might have to supplement here and there, maybe like adding some protein powder to your smoothie. I'm a really big fan of this protein brand. Oh God, what is it called? ProMix. And they have many different versions. They have a plant-based version. They have a whey-based version, and it's about 25 grams of protein per serving. They don't add a lot of stuff to it, and it tastes as good. So that's one that if you're like, I want to get some protein in with my smoothie easily, like in the morning, that's a great way. Also things like eggs. I did an egg and avocado sandwich for lunch yesterday, and that was a nice way to get like those 25 grams in. So just kind of experimenting with what you like, and keeping in mind too, again, for the plant-based folks, because I know sometimes, or people who are like eating salads and things for lunch, sometimes people will add like a tablespoon of beans thinking that they're getting enough protein, but you're definitely not. You would have to have about a cup of beans to get about 15 grams of protein, which is, it's a lot of volume of beans. So that's why sometimes if you're only eating those plant-based foods, you might have to supplement here and there.
Got it. All right, I'll take this question because I have had some experience with this. Should I use a glucose monitor actually at home, or should I just be getting screened by my primary care person? So screening is one thing, and I just say, yes, I want you screened, right? Because I think information will empower you to understand what you can do to optimize your health, right? So get screened. If you have access to a glucose monitor at home, they can be very helpful. Generally, insurance will not pay for the glucometer unless you have full diabetes. So if you're in the pre-diabetes range, in general, they will not cover it. So if you can access one, it'd be great. There is a program called Free Libre that may give you a free 2 weeks of one. And then if you like it, you can actually purchase more. So our MIDI clinicians can help you access that, because you do need a doctor's order to access the free one. So how glucose monitors at home help? I actually tried one. I had pre-diabetes, and I wanted to see what helped. And I actually did a couple experiments. I ate the same thing for breakfast every day. And one morning I exercised, one morning I took a metformin pill, and one morning I did nothing. I just sat and did telehealth all day. So, and it was interesting. my sugars were really high with inactivity and doing nothing, but actually going to the exercise class before in the morning before work actually helped my sugars all day long, even though I ate the same thing. So it really kind of impressed upon me how much exercise was an important tool for me. I also, for whatever reason, when I ate grapes, my sugar went so high that I really can't eat grapes anymore because psychologically I'm thinking about the high sugar. So I think what the glucose monitors can do is really help you look at what you're doing every day and what triggers high and what triggers more of an even keel curve, which is in general the goal.
Yeah.
So I don't know if you've had patients do them, and if you've had, I actually think the information can be very motivational on the lifestyle adjustments.
Yeah, I think it can be helpful to get that real-time feedback. I also did one, and you see that everyone's body's different. And I always tell the story, I had a huge plate of pasta with I was out to eat, and it was like a ton of oil, and my blood sugar was completely stable. But then like a breakfast you would think like might be more balancing for some people. For me, like I think it was, I don't remember, like eggs and toast and like spinach. It's went a little bit higher. So it just goes to show that everybody is different. And while there are certain guidelines, like, it's good to be individual. The other thing I was going to say with the grapes is, did you try having the grapes? Like, and this is like why it's always fun to experiment, but pairing those with something like a fat or a protein, because that might help the spike not be as drastic.
Right. No, that's exactly it. So you get the nuance of how your body reacts. That was just eating them independently.
Okay. Yeah, that's what I would say for anyone who's like, oh my gosh, this one food. We always recommend trying to, especially for folks with diabetes, trying to pair like with snacks, carbohydrate with a fat or protein, because that's going to help it come down, which is why I think the pasta paired with all the oil kept my blood sugar stable.
Are glucose monitors even accurate? They do have data that they're accurate, and I think they're really good on trends, right? So if you actually look at your mostly glucose monitors, they'll give you a sort of a curve. The one warning I would have is they tend to alarm at night and disrupt your sleep, which I don't think is good for your overall health.
Yeah.
It's really those are intended for persons with diabetes that might be taking insulin. If you're not taking insulin and you're not diabetic, you don't need the alarm to go off at night. So if you use a glucose monitor and don't have diabetes, I would turn your alarm off at night. That would be my one tidbit on that. There's some other questions. Can you eat too much protein?
Yeah, I saw that one, and I was actually thinking there's a really great podcast episode by Christy Harrison, who is a dietitian, about this topic of like, do we need all this protein and what is too much? And that's why I recommend like the 25 to 30 grams, because you can have too much protein. And especially for somebody who might have kidney issues, because someone asked about the calcium potassium, like if your body is having a harder time with the kidneys and like kind of clearing that protein out, like that can potentially cause some damage. And also too, and this is a point that she brings up in her podcast, is like, I think we can take things too far often. And I do see a lot of people where it's like, I need 200 grams of protein a day, or I have to eat, my protein and body weight. And so they begin like force feeding themselves protein, and then it's at the expense of every other nutrient. And so I think it's always important to have a balance. And if you're noticing you're having so much protein that you're not able to have any room for carbs or fats or veggies, and that is where it becomes a problem. So just kind of common sense and listen to your body.
Okay. And here's another good one. So if you have prediabetes and high cholesterol, are there sort of like global food tips you would give?
The interesting thing is the eating pattern for somebody who has pre-diabetes is going to be similar to somebody who has high cholesterol. And it all goes back to the MyPlate method, which is my favorite tool. So incorporating vegetables, fiber is so great for cholesterol. because it's a natural way to help bring that cholesterol down. Same thing for prediabetes, as we talked about. It's a natural way to help bring the blood sugar down. So including those high fiber foods, I feel like if you just did one thing, that's probably going to be super helpful. But also including those healthy fats as well is going to be helpful, especially for high cholesterol. So I mentioned before, like the flax seeds, the chia seeds, things like olive oil, avocado, nuts, those will all be helpful with the cholesterol too.
Okay.
I see a question about vitamins and supplements like fish oil. I can start with that one. So fish oil has been, studies suggest that it is really helpful for people with high triglycerides, which is essentially high sugar in the blood, high fat in the blood. So, taking fish oil for that, might help to bring it down. And in terms of just vitamins and supplements in general, and especially for diabetes and prediabetes, we actually just recorded a podcast episode about this. Our podcast is called Diabetes Digital, where we go into all of the supplements that are linked to diabetes and whether or not they're helpful, what the evidence suggests. But one of them that does have some evidence is cinnamon. And taking cinnamon has studies suggest that it can help lower the blood sugar. So what we recommended and what we talked about in the podcast was maybe you don't take a bunch of capsules of cinnamon, but you just naturally like sprinkle it in your smoothie or on your oatmeal, things like that to, don't overdo it, because there was some risk for people who overdid it with a certain type of cinnamon capsule. So that can be helpful. And then if somebody is just like, oh, I want to cover all my bases and have one vitamin that has a good amount of all of these, different nutrients, Centrum is a good one that I recommend. Of course, it's a supplement. It's not going to replace like a balanced diet, but Centrum is good. And I also really like Ritual. I feel like that one also has a good balance and quality ingredients.
Mm-hmm. Yeah, and probiotics have been shown to improve, right? Berberine has some positive effects on cholesterol, maybe even hypertension. So I really think it depends on the constellation of symptoms you have, right? There are supplements that like Cortisol Manager, which is going to decrease your stress hormone if that's a big layered component for you. So I think it sort of depends on what your diet is currently, so where you might be deficient, and then sort of what your health triggers are that you're experiencing. So unfortunately, there's not a one for everyone.
Yeah, exactly. And that's why it's good to work with your doctor or your dietitian whenever you're adding anything like supplements, especially if you're taking medications, or you have other stuff going on. Because there were supplements, and honestly, like many of the supplements that can be helpful for diabetes can also be harmful at certain amounts, or if you have other conditions. So it's important to like do everything, if you can, in conjunction with your healthcare provider.
Okay, I love the question about sunflower oil versus other oils. Is there any sort of global learnings there, Jessica?
Yeah, I know that that's definitely a controversial one with like the seed oils, and I feel like there's a lot of fear mongering. I cook mostly with olive oil, and I feel like that's just a good choice for many people. And I know people can be afraid of smoke points and things like that, but the nice thing about a smoke point is it does have a bit of a higher smoke point, but you can also see it smoking. So it's like everyone, knows when it gets too hot because it starts to smoke. So just, making sure that doesn't happen. But yeah, that's kind of like my go-to that I like to recommend for people. But if there's another one that you really like, or that, again, access is a important part of the equation and maybe that's not accessible, so then I would just, recommend going with what is available to you.
Okay. All right, I'll squeeze in one last question. It's about women in perimenopause that are just taking progesterone. So some sometimes in perimenopause, women take progesterone. It really kind of helps with the period shifts in particular that you see in perimenopause, and somewhat with sleep that you see in perimenopause. And they're asking whether it affects metabolism just to be on the progesterone. So I'm going to say two things. One is not in your question, but I'm going to answer anyway, is that I think women in perimenopause underutilize estrogen. There are some, if really you want period control, progesterone is helpful. But the estrogen depletion in perimenopause is real. And you can benefit from hormone replacement therapy with estrogen before you're fully menopausal. And again, I think too few people access that. But okay, so some women do get just progesterone and that's all they need in perimenopause. Does that positively impact their metabolism? We don't really know because most of the studies are either with combination estrogen and progesterone or estrogen alone. And the estrogen alone group was really done in, at the time, there were 30% of women that had hysterectomies. So they did not need progesterone. But there are not a lot of studies done with people receiving progesterone alone. So I would say a safer bet is to do some estrogen with it. And you will start to accumulate other symptoms that will benefit more from the estrogen anyway, right? When you're looking at things more broadly like bone health, looking at some of the impact estrogen has on sort of panic and serotonin and mood changes, as well as metabolic changes in midlife. All right. So I just want to thank you, Jessica. I have learned much from you today, as I do every time we meet. And thank everyone for coming to our webinar. And I'm going to pass it over to Kenesha to wind us up.
Yes, thank you so much. I'd like to also extend a thank you to our speakers today for just covering all of the basics of prediabetes and menopause and the total health, everything like that. Thank you so much. Please follow us on social media if you are not already, because we announce these events and we have resources also in our link in bio on social media. And also Diabetes Digital information is here as well, so you can follow them. And they also have in the resource tab, a download where you can learn a little bit more about their services and what they offer. So thank you so much for attending our webinar, and look out for our next webinar schedule in our link in bio on social. Any closing words, Jessica?
Thank you for having me. This was wonderful. I really enjoyed it. And yes, check us out. And that's my fault that the Instagram is wrong, but ours is Diabetes Digital Co. That's where we're most active. So we hope to see you there.
Okay, thank you. We'll also include that in our recap email that goes out with this replay. We'll fix the link there. Thank you so much.
Thank you, everyone.
Okay, bye.